There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, does hypoglycemia cause high blood pressure? Answer by Angela Punis. Hypoglycemia occurs when the level of glucose, sugar, in the blood is too low. Normally, your body keeps your blood glucose within a concentration range of 4.0 mmol/L to 8.0 mmol/L, about 70 mg/d, L to 140 mg/d, L. In order to do this, the body has mechanisms that involve the hormone insulin, which is made by the pancreas, as well as several other hormones. Video here. Blood pressure exercises vs LCB. When blood sugar levels rise, the pancreas responds by releasing insulin to encourage the movement of glucose from the bloodstream to the cells. Insulin lowers the amount of glucose in your blood by signaling the cells in the body to use the glucose as fuel. Your body uses glucose as its main fuel. The brain requires a constant supply of blood glucose and will signal the adrenal glands to release two hormones called adrenaline and cortisol whenever blood glucose levels are low. The adrenaline and cortisol then signal the liver to convert the carbohydrates it stores, from the foods we eat, into glucose and release it into the bloodstream. A pancreas is also involved in raising blood glucose levels if they fall too low. When blood sugar is low, the pancreas releases the hormone glucagon, which increases blood sugar by signaling the liver to convert stored carbohydrates into glucose and to create new glucose molecules from other substances, such as amino acids, in the liver. If these mechanisms don't work properly, the blood glucose remains too low and the brain won't be able to function normally. Hypoglycemia can also be caused by a problem with the pituitary or adrenal glands, the pancreas, the kidneys, or the liver. The pituitary gland controls the body's production of some of the hormones needed to raise the body's blood sugar levels if they fall too low. These hormones including cortisol, which is released from the adrenal glands, glucagon, which is released from the pancreas, and adrenaline, which is released from the adrenal gland medulla. These hormones all help raise blood sugar levels. If they are not working properly, this could cause hypoglycemia. Hypoglycemia can also result when the liver can't properly store carbohydrates or convert them into glucose. A tumor on the pancreas can also cause hypoglycemia by causing too much insulin to be released. In cases of severe kidney dysfunction, hypoglycemia might also develop. Eating or drinking 15 grams of carbohydrate, sugar, usually relieves the symptoms of hypoglycemia within minutes. The sugar should preferably be in the form of glucose or sucrose tablets or solution. Glucose gels, fruit juice, candy, or pop are alternatives if the preferred options are not available. People who take the diabetes medication acarbose must use only glucose, not sucrose, to treat their hypoglycemia. Sucrose is normally broken down in the body to produce glucose, which is needed to treat hypoglycemia. But acarbose blocks sucrose from being broken down into glucose. People with diabetes who use insulin or medications that promote the release of insulin by the pancreas should always carry a sugar product with them for treating mild to moderate hypoglycemia. Most people will get an increase of 2.1 mmol/L, 38 mg/d, L, within 20 minutes of taking 15 grams of carbohydrate. After taking the sugar, the person with hypoglycemia should wait 15 minutes and test their blood glucose. If it is still less than 4.0 mmol/L, approximately 70 mg/d, L, another 15 grams of glucose should be taken. Answer by Ruben Fogg. Hypoglycemia is a very common side effect of insulin therapy and, to a lesser extent, of treatment with oral hypoglycemic agents. Severe hypoglycemia can precipitate adverse cardiovascular outcomes such as myocardial ischemia and cardiac arrhythmia. These are mainly secondary to autonomic activation, which results in hemodynamic changes, vasoconstriction and rise in intravascular coagulability and viscosity. The Canadian Diabetes Association classifies hypoglycemia as follows. Mild symptoms caused by release of extra adrenaline, see above, are present. The individual is able to self-treat. Moderate symptoms caused by release of extra adrenaline and by lack of glucose getting to the brain both occur, but the individual is able to self-treat. Severe, the individual requires the assistance of another person. Unconsciousness may occur. Blood glucose levels are usually less than 2.8 millimoles/L, 50 milligrams/D. L. Other causes of hypoglycemia. Alcohol abuse. The liver can stop releasing stored glucose into the bloodstream if somebody has been drinking heavily. Some liver diseases. Drug-induced hepatitis can cause hypoglycemia. Kidney disorders. People with kidney disorders may have problems excreting medications. This can result in abnormally low blood sugar levels. Answer by Hershey's bacteria. Thyroid conditions such as parathyroid disease, adrenal insufficiency, Addison's disease, low blood sugar, hypoglycemia, and, in some cases, diabetes can trigger low blood pressure. Dehydration. When your body loses more water than it takes in, it can cause weakness, dizziness and fatigue.